Hello, my name is Sarah. I'm a fourth year nursing student, and today I'm going to talk about my summer studentship with the EMBER study, otherwise known as the Exploring Mental Health Barriers in Emergency Room Study. My project this summer was called the Stigma Cultures in Healthcare Scale Findings to Date, and here are all the lovely people that helped make this project possible. As an introduction, the EMBER study is a 6-year study that aims to better support patients and families visiting the ED for mental health concerns. The aim was to examine mental illness stigma in the ED, particularly at the structural level, which is manifested by policies and procedures that create inequities for individuals facing mental health and substance use challenges. Livingston 2020, Thornycroft et al. 2022. The EMBER study is funded by the Calgary Health Foundation, and my studentship was funded by Alberta Innovates. We used a mixed methods approach for this phase of the study, and the measures we used were created in collaboration with the Mental Health Commission of Canada and included the Stigma, Cultures, and Healthcare Scale, which included 23 questions, and the Patient Experiences of Mental Health Care Scale, which was 8 questions. These combined to form a survey that consisted of 31 questions. And each of these questions provided the participant with a statement and asked them to indicate how much they agreed or disagreed with the statement using a Likert scale. And 8 of those 31 questions also had the option to add a qualitative response or written response. We used a variety of recruitment methods, including postcards and posters, as well as direct recruitment in inpatient units and at the emergency department itself. Here on the right-hand side is the number of participants / total surveys we had completed by May 21st, 2024. For quantitative result, we ran a one-way ANOVA, which showed a significant difference between the reason for visit on the total score on each of the scales. And we analyzed the last question separately as opposed to including them within the scales. So as you can see here, those visiting the ED for physical health concerns are represented in orange. Those visiting for mental health are indicated in blue, and those visiting for both are indicated in green. As you can see, that the stigma score for those visiting for mental health is consistently higher than those visiting solely for physical health. So for the qualitative results, I organized it based on the themes that I was seeing, and I included a sample quote for each of the themes here. So the first one was distressing physical environment. Then we had inconsistency in quality of care, which included comparisons drawn with other EDs, inconsistent medication use, and the separation of mental health and physical health care. Next, we have staff attitudes, which included dismissal of mental health concerns and patient feedback, encroachment of protective services. Next, lack of resources, which included insufficient community resources, wait times, disregard for patient rights, which included exclusion from treatment plans and restriction of family support. Next, we had appreciation for the care received, and lastly, recommendations to improve care. In conclusion, our findings supported the presence of structural stigma, otherwise a culture that allows stigmatizing treatment of patients with mental illness and or substance use. Interventions are needed to address structural stigma, to shift ED culture and reduce experiences of stigma. Results should be monitored as changes are made to the ED environment, such as renovations and staff training. Structural changes to the ED culture and environment have the potential to make a positive impact on patient experiences and outcomes. Here are my references. Thank you so much.